A very good afternoon to all of you. My name is Roshini and thank you for joining our Facebook Live session this afternoon. Today we have two amazing speakers with us, Ms. Farhana, who's our play therapist, and Ms. Noor Shahida, who's our occupational therapist. And they are both from our Child Development Centre at AVISENA Women's and Children's Specialist Hospital. So today they'll be sharing with us on the topic Children with Autism, Benefits of Play Therapy and Occupational Therapy. Now, let me introduce our very first speaker of the day, Ms. Farhana. Before we begin, just a brief introduction about Ms. Farhana. She graduated from International Islamic University, Malaysia in 2016, where she obtained her degree in psychology. And in 2018, she pursued her master's in developmental psychology and therapeutic play at Swansea University in the UK. Prior to taking up her current role at AVISENA, she worked as a teacher at Idrisi International School, Setia Alam for 2 years. And before that, she was a trainee play therapist at Play and Leisure Opportunity, which is an NGO based in Wales for about 1 year. So without any further ado, I would like to invite Ms. Farhana to join our session today. Hi, Ms. Farhana.
Hi, good afternoon.
Good afternoon. How are you?
I'm good. Thank you so much.
That's
for having
great.
me today.
The floor is now yours, Ms. Farhana.
All right, I'll
Thank
share
you.
the screen.
Sure, please do.
Okay, can you see my screen now?
Yeah.
Sorry. All right. Okay, thank you everyone for joining us today. So I'm Noor Farhana, as me, and I'm the play therapist here at AVISENA Women's and Children's Specialist Hospital. And today I'll be sharing with you on the topics of benefits of play therapy for children with autism. So basically, before I start to say about play therapy, we are now in the month of Autism Awareness. So I would just like to share with the audience about what is autism. So the full name of this disorder is Autism Spectrum Disorder, or the shorter version is ASD. And then what is actually Autism Spectrum Disorder? It's actually a developmental disorder that affects communication and also behavior. Okay, so why developmental means the child was born with autism. It's not something that happens due to accident or due to any environmental effects. It's actually something that happens during the development of the child from the fetal already. Okay, and then why is it called spectrum? So this is quite interesting because in autism, there is a wide variation of the types and also severity of the symptoms. So when people or a child is diagnosed with ASD, the symptoms that they show or the symptoms that they have is different from one another. So as to say that one child with ASD is different from another child with ASD. So I'll just show you how to imagine what a symptom looks like. So can you imagine there's a red line? Okay, so at the beginning of the line is mild, while the end of the line is severe. So if a child is on the mild spectrum, the symptoms that they have or exhibit is milder. They, for example, they are sensitive to light, or they have poor eye contact. If they are on the moderate spectrum, the symptoms that they show is more moderate. than the mild one. And for the severe spectrum is what we call as Asperger's syndrome. So this one is I would say the symptoms are quite severe, such as they have difficulties to make conversation with people, and then they also shows a lot of a very high sensitivity towards touch, light, and also what is it, the last one, sorry, I forgot about that one. Okay, so but you can check it out that these three children on the spectrum is very much different from each other. Okay, so let's go with what are some of the symptoms that children with ASD might exhibit, and I will share more related to play, because that's my field. So number one is they will show communication deficits. So usually the child will respond inappropriately in conversation, or maybe they're not making eye contact while playing with another child. And because of this communication deficit, the child will have more difficulty to build friendships or relationship. Some of the case studies that I have is the child also have difficulty to even build a strong relationship with the family members, although they spend a lot of time together. And then number two is social relationships. So children with ASD have difficulties in initiating and joining in play. So some of my clients, the parents told me is that they usually play alone during at school. So because they have difficulties to try and connect with other children. So even if they like playing, but they have it's harder for them to join to play with other children. And they also have difficulties to understand turn taking. They're not sure when is their time to how they want to respond after someone gave them a ball maybe. So they have difficulties to also understand social cues. Like for example, if a child is giving them cues such as, oh, I want to play with you, they have difficulties to understand, oh, that another child is trying to give me signals that they want to play with me. So they also have a harder time to also participate in reciprocal social interactions. So if you can see them, people might say that they are quite stagnant or unresponsive. It is because of they have that because one of the symptoms of ASD is they have harder time to connect with other people. Okay, and then in terms of play, children with ASD, they also experience some play deficits because normally children will go through the 6 stages of play. Okay, but for children with ASD, they struggle with symbolic play, in which they can't really relate with another object. Like for example, for a child 2 to 3 years old, they can start to see a ball, and then they can play, like they symbolize the ball as something that is fun, or maybe something that, okay, they can play with another person. Or for example, if they have seen their mother cook before, and they know all the kitchen utensils or kitchen equipments like the pan or the, what do you call this one? Can't remember in English, like the sudip, right? So when we give them a toy kitchen set, they have a bit of a struggle to try and relate from what they've seen before, and that's when they struggle with symbolic play. And then, as I mentioned earlier, they also prefer to play alone due to the difficulties of playing with another child. And then they also show a preference for toy based on sensory stimulation. This is due to their sensory stimulation is not very much developed as a normal child. This one, our next speaker will be more expert in telling you about sensory stimulation. But in play, due to that, the child has the tendency to play with a very limited options of toys or play materials, hence not really helping them with developing themselves or following the proper developmental stages. Okay, for the last one is the quality of play in children with ASD is that they tend to display a repetitive and also stereotypical quality of their play. So if the child is quite obsessed or they really like playing with, for example, I would give video games or Beyblade, then they would just play with that thing. They would just repeat the play a lot of time. Okay, it's hard for us to try and make them break that play chain and introduce to them to play with other toys or other play materials that might be more suitable for their developmental stages. And then it is because of this, it can be quite challenging for their peers to navigate together with them during a play session. So due to this, some of the peers tend to like go away and play with other kids. So this ends up the child being left alone and playing alone. So with that in mind, what play therapy can do is to really help children with ASD to try and alleviate them from having all the symptoms, or maybe just help them to build how to practice more on how to connect with their peers and how to use different play types to actually help children with ASD to learn about communication and how to build social relationship. So I'll also tell you a bit about what is play therapy because some of us might not be familiar with this kind of therapy as it is a relatively new type of therapy. So this is a therapy which the approach uses play to communicate with children, and the goal is to prevent and resolve psychosocial issues and challenges. So for example, like in my situation, most of my clients or patients are children who experience trauma or they have emotional difficulties, like they might have some trust issues with their family members or with other adults, so they come to me to like be more aware of their emotional state. And at the same time, play therapy also uses some play skills to strengthen the resiliency of children, not just for children with developmental issues, but also for normal children, but they're going through some hardships, like maybe parents just recently get divorced, or they had trouble coping with maybe changes in their environment, like maybe they lost a family member or someone they really loved. So children might have a harder time to try and regulate their emotions and even to try and express. So true play therapy is where children are able to express themselves using play. And some of our goals are helping kids gain greater awareness of their feelings and also teach them how to express the feelings in a more positive ways. So play therapy isn't just for children with developmental difficulties, but also uh, can be widely used for children, normal children experiencing emotional turmoil or going through a very hard time. Okay, so I'll also share with you how is play therapy used to treat autism. Okay, so number one, I'll just highlight that play is the natural language for children, regardless of their background or their developmental stages. All children plays, right? Even children with ASD uses play as their natural language. So play is the easiest way for them to express any troubling thoughts or feelings. So even for ASD children with ASD who is probably not talking yet, so they can use play as a way for them to communicate with their family members, with their therapist, for example. So even for other types of therapy, they also utilize play as one of their approach in helping the child. And then number two is we focus on the interests of the child. So what our therapy session will be designed specifically and specially for the child, using to meet their needs. So we will help them to come out from their shell and help them to communicate and relate more easily to others. So what I usually use will be a lot of role playing, a lot of pretend play, and also parallel play is something that most children with ASD is familiar with. So you want to try and get them to do more play that is uh, together with other people. So it's more like peer playing as well. And then we also use two different approaches. Number one is non-directive play therapy. So for non-directive play therapy is where the child is the person who will lead the session. So the therapist's role is more towards following the child, and from time to time we will try to navigate how they approach their play. And for the second one is directive play therapy. So this one is a bit more I would say, like, the therapist will be the one who's directing the session. So we will be introducing new things for the child to be exposed to. But we use both of this approach interchangeably. So it depends on how the child is, how's the child's developmental stages, and what are the things that we want them to be improved on, or yeah, it depends on their needs. So we are specially design or tailor the session for different child, different tailored session. And then the last one would be engaging element in the play therapy. So most of the interventions in play therapy, we provide them with the skill component that they need to increase their functioning ability. So for example, if the child they can't really communicate verbally, so in the play therapy, we will mostly use communication as the basic of the session, of the play session. So we will try and help them improve their communication through group play, or maybe role playing, where they are given a role and they need to act out that role, even though they won't use verbal. But from time to time, we try to like increase their communication, even non-verbally. Okay, and then how do you keep them entertained? Okay, so this one is so for a play therapy session will last around half an hour to 45 minutes. So that's quite a long time, right, for children. So what we do is we do have what we call interval time, all right, or time interval. So as you can see is that we will tailor several play Hello.
Farhana, oh, okay.
Yeah, sorry. I think my audio, my internet got disconnected just now.
All right. You can
Okay.
continue with where you have stopped earlier.
All right. So I was talking about the time interval just now. So it's okay. Let me start again with the example. So if we start the session with a 15 minutes of symbolic play. So in symbolic play, we will usually give the child with different sets of toys, so that we want to, and then they are given the freedom or the choice to choose whichever toys they wanted to play. So for example, we might have some block sets, we might have some dolls, and then we want to see them how are they interacting or responding towards the I mean, not responding, how they do about playing with those toys, because from how they play it can also reflect to us in terms of their developmental difficulties as well. And then we will have a 5 minutes break. So usually during this break, we will either give them a time to go to the toilet, or maybe if they want to like just have a free play, like they can just do other stuff in the play therapy room. Okay, and then after the break finishes, we will have another 15 minutes of social play. So usually this one will be a bit more interactive between the therapist and the child. So in a way, we will have a more interactive session with me and because during this time I want to see how are they responding or reacting. Okay, and then another 5 minutes break, and the last one would be a therapy play. Usually a therapy play is what we call as when we invite either one of their caregivers, either the mom or the dad. So this one is more if the with the consent of the parents, if they want to join in. If not, we can just continue with the social play. Okay. Next, so these are some of the activities that I can do with autistic child, or maybe some parents at home, you can try and do it as well if you have an autistic child. So we call it as a floor time activity, or if we do it in the play therapy room, we call it floor time therapy. So basically the parents or the therapist will physically get down onto the floor to play with the child. So you can go, maybe if you want to start first with just half an hour, because 2 to 3 hours might be a long time and some of the parents could not commit, or maybe the child also could not play that long. So maybe we can start with a half an hour activity first. So you can just focus on the child, on any activities that the child enjoys. So if they like Legos, you follow them and play Legos with them. If they like to play dolls, you play with them. So in a way, we want to signal to the child that we want to enter into their world. So to children, when they allow us to play together with them, means they have trust in us. So if they don't allow you to enter their play session, then it might signal that you have to try and win their trust and win their hearts. So and when we follow what the kind of activities that the child enjoys, we are showing that we acknowledge and love what they are doing. Okay, we are giving them the green light and maybe saying that what you're doing is great. So by doing this floor time activity, you are actually improving your child's ability to engage, because during this activity, the parents will try to be as engaging as possible, ask them questions, but please don't ask hard questions. Maybe just ask, if you're playing Legos, you might ask, oh, what color are you gonna use next? Okay, something that makes them engaging, but not too hard as to shun them off. Okay, and then also to develop their two-way communication. So when you are on the floor together with them, or even if you want to make it on the table, it's fine, but try to be on their level. So the child will feel that, oh, someone is interested to know about their world. Okay. Next one is, this one is one of the, because what I see is most of the children with ASD, they really love Legos.
Sorry, Farhana. Sorry,
Yes.
Farhana. You just need to share your slides
Uh-huh.
to the audience. Yeah.
I need to share?
Yeah, reshare your slides.
Oh, okay. So I wasn't sharing just now, is it?
Yeah. Okay.
Okay. So, okay, where was I? So it's the Lego-based therapy. So when you, usually Lego-based therapy is where we have more interaction between the child and also the parents, or maybe you can include their siblings as well. Okay, during this session, during this activity, so that there will be a lot of interaction, a lot of engagement, turn taking. So to the child, there, to them it's actually just playing, but actually behind it there's a lot of development happening, like especially social skills, if they play with parents and also their siblings. So you try to be engaging as possible, and see if they are doing some turn taking and collaboration. Collaboration is when they build something together, and then also social communication when they are talking to each other about building the Legos or the buildings. All right. And then the last one would be a case sorry, a case scenario where I would like to just share with you that I had a patient age 7 years old, and then he has been diagnosed with ASD. I think it's around 5 years old, and then he was doing okay. I mean, he had gone to school already. He has been going to therapy, but when he enters the classroom, I mean, 7 years old is already in year 1. Okay, so the parents got a report from the teacher saying that the child prefers to play alone and they have difficulty to play with their peers and not really engaging. So when the parents came to see me, they told me about all this, and then I suggested to them to do the treatment plan that I suggested for the boy is an odd play connection, the name of the treatment. So odd play connection is when the parents are also involved in the play session, not just the therapist. Okay, so why is this so? Is because we want to make sure that even in the home setting, the parents are able to do the same therapy session with the child, because we don't want it to be a weekly thing, but we want it to be a normal daily routine for the child as well. So what happened is in the first few sessions will be the therapist having a play session with the child, and the mom or the father will join us to observe. Okay, so they will observe on how the therapist conduct the play session, and then after a few sessions, and we try to see if the mother is confident enough to do her part. So we will start with somehow it's kind of the mother is doing the session with the child, but with the therapist supervision. So we will do it for a few sessions to see if the mother is confident enough and she can do it by herself at home. So this currently it's still ongoing. So I'm not sure yet, but he has been showing a lot of improvements. All right. Okay, so that's all from me about the benefits of play therapy for children with autism. I'll pass the floor now to Roshini. Thank you so much.
Thank you, Ms. Farhana, for the informative session. Now, to our participants who are joining our session now, if you have any questions to ask, please feel free to drop your comments at our comment section on Facebook page, and we will answer them at the end of our session. Thanks, Ms. Farhana. Now, let's move on to our second speaker for the day, Ms. Noor Shahida. A brief introduction about Ms. Shahida. She is a graduate from University Technology Mara in Punca Alam, where she received her bachelor's degree in occupational therapy in 2016. She is also a member of the Malaysian Occupational Therapy Association since 2020. Prior joining AVISENA, she worked at CADS Enhancement Centre in Kuala Lumpur, and she has worked closely with autism children for 5 years. So let's welcome Ms. Shahida. Hi, Ms. Shahida.
Hi.
Hi, Ms. Shahida.
Hi,
Can you hear? Can you hear?
Yes.
Okay, that's good. How are you?
I'm fine, thank you.
Very well. So you may begin your presentation.
Okay. Do you mind if I speak in Malay?
Sure. Anything that makes you feel comfortable.
Okay, right. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you to my colleague. Okay, before this, I kenalkan diri I. Okay, saya Noor Shahida binti Muhammad Kamal, merupakan occupational therapist daripada Child Development Unit, AVISENA Women and Children Specialist Hospital Shah Alam. Okay. apa itu occupational therapy untuk kanak-kanak? Okey, biasanya apa yang occupational therapy akan buat? Buat penilaian. Okey, seandainya parents rasa anak itu ada masalah ataupun tak. Biasanya kita akan buat screening test ataupun assessment dan kita akan compare sama ada budak tu dili ataupun tidak dalam perkembangan mereka lah. Okay. So biasanya apa yang kita tengok? Yang pertama adalah sensory integration. Okay, sensory integration ni biasanya kita ada pendengaran, okay, kita akan ada penglihatan. So komponen-komponen ni kita akan tengoklah sama ada budak tu integrate well ataupun tidak. Okay, seterusnya kita akan tengok pada fine motor skill. Okay, fine motor skill ni adalah pergerakan motor halus, okey, di mana pergerakan motor halus ni dia akan membawa kepada pre-writing skill. Okey, sebabnya pergerakan motor halus ni penting untuk anak-anak tu menulis bila diorang dah masuk sekolah nantilah. Okey, seterusnya apa lagi yang kita tengok? Kita akan tengok pada fokus skill anak. Okey, biasanya kat sekolah cikgu akan komplain, okey, anak you kurang fokus dalam kelas. Okay, so that's why diorang akan bring to the therapist lah untuk evaluate the child. Okay, seterusnya kita akan tengok dari segi komponen self-help skill. Okay, self-help skill ni biasanya untuk anak autism kita akan fokus more pada toilet training. Okay, whether the child boleh buka baju sendiri, pakai baju sendiri. Okay, it's all about pengurusan diri lah. Okay, seterusnya social skill. Okay, social skill ni biasanya kita tengok sama ada dia boleh masuk group ataupun tak. Okay, so biasanya kalau anak-anak nak masuk group bermain bersama, okay, kita akan tengok whether the child can taking turn, okay, ataupun sharing the toys together ataupun tak lah. Alright, dan seterusnya kita akan tengok dari segi behavioral modification. Okay, anak autism biasanya mereka akan ada masalah tantrum. Okay, biasanya tantrum yang diorang shows biasanya kalau tak dapat toys yang diorang nak. Okay, dan juga mereka akan tantrum jika kita akan bergerak daripada satu tempat kepada tempat yang lain. Okay, diorang punya tantrum tu macam lain sikit lah compare dengan anak normal. Okay, alright, seterusnya. Okay, kita tengok sedikit sign and symptom dalam babies dan toddlers. Okay, kebiasaannya anak-anak autism ni diorang kurang respon kalau parents panggil nama diorang. Okay, sebabnya walaupun parent tahu anak dia punya pendengaran, okay, dengan penglihatan semua normal, tapi kenapa anak tak respon bila parent panggil nama? Okay, then biasanya diorang akan lack of eye contact, okay, to the parent ataupun pada aktiviti yang diorang buat. Okay, and then biasanya anak suka tengok benda yang berpusing. Okay, benda yang berpusing, okay, benda contohnya tayar kereta, mereka suka sangat tengok benda tu tanpa ada tujuan pun sebenarnya. Okay, they enjoy it, right? And then kebiasaan juga mereka suka tengok pada benda yang contohnya kipas kan suka berpusing kan. Kadang dia orang suka tengok benda macam tu lah. So kita jadi macam pelik, kenapa dengan anak aku suka tengok benda macam ni kan. So it's actually a early sign of the autism lah, alright. And then biasanya autism of course dia akan ada limited social skill, okay. Diorang tak tahu cara nak main yang betul, okay. Walaupun diorang play, tapi play tu bukan play yang appropriate for their age, alright. Okay, kita tengok sikit lagi sign and symptom. Okay, kebiasaannya sign and symptom autism kids ni dia akan semakin nampak bila budak tu semakin besar, okay. Terutamanya, okay, saya cuma ambil sikit je Okay, kalau diorang main car contohnya kan, diorang akan suka susun car tu, jarak tu kena sama. Okay, tu antara satu ciri lah, dia nak jarak tu sama. So bila kita kacau, dia main, dia akan susun balik cara yang sama dengan jarak yang dia dah start tadi. Okay, and then biasanya diorang suka juga categorize the car tu ikut colour. Okay, so bila kita kacau colour tu, diorang akan tantrum dan diorang akan start susun balik dengan cara yang diorang nak. Okay, itu antara salah satunya lah. Okay, dan lagi yang biasanya anak autism ni diorang susah nak deal dengan changes to the routine. Okay. For example, budak ni dah biasa guna cawan hijau. Tiba-tiba you bagi dia cawan merah hari tu. Okay, so anak tu akan show the tantrum. Kadang parent tak tahu kenapa anak macam ni. Okay, sebab ciri autism salah satunya dia tak suka dengan changes of the routine. Okay, tapi pada masa yang sama, parent kena belajar untuk break the pattern. Okay, tapi just know the sign dulu lah, right? So biasanya sign and symptom ni kalau parent nampak, bawa jumpa pakar. Okay, sebabnya diagnosis pakar kanak-kanak yang pakar developmental kanak-kanak yang boleh diagnose lah. Okay, kami terapis cuma nampak sign and symptom dan kita akan buat treatment. Okay. Alright. Okay, now we take a look. Okay, macam mana occupational therapy help in autism kid? Okay, so I bawa sekali dengan case study lah kat sini. Right. Okay, for example, okay, child A 3 years old, so diagnosed sebagai autism. Okay, so biasanya bila anak datang kepada terapi setelah didiagnos oleh doktor, kita akan buat assessment. Okay, first kali kita akan tengok apa parent concern pasal anak dia. Okay, so kebiasaannya parent akan komplain, okay, anak saya limited speech, tak cakap. Okay, salah satu ciri autism adalah dia orang kurang bercakap. Okay, bila kurang bercakap, that means they have limited two ways communication and interaction skill. Okay, diorang mesti akan just play alone at home. Okay, so bila parent interrupt untuk play, diorang akan marah. Okay, and then they will not consistent respond to name calling. Macam cakap tadi, biasanya parent akan komplain benda ni. Yang ni sangat ketara lah biasanya. Okay, diorang walaupun tahu hearing normal, they still doesn't respond to it. Okay. And then dia akan poor joint attention. Okay, joint attention ni apa? Joint attention ni adalah fokus bersama. Okay, contoh bila parent cakap, for example, Ali look at there's a bird. Okay, there's a bird. So anak tu dia tak respon langsung pun pada apa yang parent dia cakap. Okay, that mean tak ada fokus bersama. Okay, anak tu lebih suka lari-lari. Okay, dia buat tak tahu je. Okay, so tu poor joint attention lah. Okay, apa lagi yang biasa parent concern? Biasa diorang tak boleh follow simple instruction. Okay, suppose untuk anak 3 tahun, ni case tadi contohnya 3 tahun, dia dah boleh ikut arahan simple. Ali sit down, contohnya. Okay, tapi anak tak respon. Okay, anak buat tak tahu, anak lari. Okay, and then Ali give teacher high five. So yang tu pun diorang tak respon. Okay, mungkin respon tapi tak konsisten. Ataupun kadang dia respon tapi selective person. Okay, mungkin dia respon pada parent sahaja. Okay, pada newcomer dia ambil masa. Okay, so tu antara biasanya yang parent concern lah bila bawa datang jumpa terapis. Okay. Okay, now we take a look. Okay, biasanya assessment yang kami akan guna adalah Denver. Okay, Denver ni dia macam kita tengok developmental assessment. Kita tengok dia punya dari segi gross motor skill, okay, motor kasar, lompat anak, baling, okay, fine motor skill, anak pegang pensel macam mana, okay, anak boleh ambil simpan ataupun tak, okay, language skill, dia babbling sahaja ke ataupun ada satu word, okay, and dia personal social, dia boleh bye-bye ke tak, ikut arahan ke tak, okay. Ni antara soalan yang kami akan tengoklah bila buat jumpa terapis. Dan juga satu lagi kita akan tengok short sensory profile. Okay, kebanyakannya kenapa anak tak respon bila kita panggil, ia adalah berkaitan dengan sensory. Okay, so nanti saya akan kupas lebih lanjut lah pasal sensory. Okay. Okay, ni antara soalan sensory yang biasanya akan ditanya kepada parent lah. Okay, so kita ada berapa sensory. Okay, kadang bila anak autism, diorang tak suka jalan atas pasir ataupun rumput. Tapi tak semua, tapi kebanyakannya ada. Okay, diorang sangat geli dengan benda tu. Okay, tak boleh pegang. Okay, and then nak potong rambut susah. Okay, nak potong kuku masalah, gosok gigi masalah. Okay, it's all about sensory. Okay, tactile sensitivity. Dia sangat sensitif. Okay, okay, ni satu tactile. Okay. Yang kedua, vestibular. Vestibular ni dia macam ketinggian. Certain anak autism, dia tak suka naik lift. Okay, bila tempat tinggi kan, dia rasa gayat tu yang melampau. So dia akan tantrum mengamuk. dan parent tak tahu kenapa sebenarnya. Okay, so it's one of the causes lah sebenarnya, tak semua tapi mostly ada. Alright, okay, then proprioception. Proprioception ni dia berkait dengan awareness of the body. Okay, biasanya anak umur 3 tahun dah boleh tunjuk, biasanya show mommy your nose, show mommy your mouth. Okay, so biasanya anak yang poor benda ni dia tak boleh tunjuk mana benda tu, mana your nose, dia akan buat tak tahu. Okay, so kadang tu kalau makan pun comot, tak perasan. Okay, biasanya anak yang ada masalah ni dia akan ada masalah untuk writing in the future. Okay, pergerakan motor halus lah. Alright. Okay, then some more, kita tengok pada auditory sensitivity. Okay, this one paling banyak menyumbang kenapa anak tak dengar, kenapa bila parent panggil. Okay, biasanya diorang ada masalah difficult in paying attention. Okay, fokus kurang. Okay, dia lari-lari sebab ada banyak gangguan dekat sekitar dia, bunyi orang buka pintu, okay, bunyi mami daddy cakap. So banyak sangat stimulation yang masuk, so anak tak boleh filter mana yang penting masa tu. Okay, that's why lah diorang tak respon pada nama bila parent panggil nama anak. Okay, inilah yang menyumbang banyakkan parent kenapa anak tak respon nama teacher, kenapa. Okay, ni sebabnya lah. Alright. Okay, seterusnya, okay, biasa kita tengok pyramid of food kan. Okay, hari ni kita tengok pada pyramid of learning. Alright. Okay, biasanya kan anak autism kebanyakannya speech delay. Okay, speech delay sebenarnya dia punya goal tinggi tau, atas. Okay, nak dapat speech ni, benda bawah ni semua kena settle. Okay, so my part I banyak conquer bagai sensory lah, sensory, motor semua ni. Okay, everything settle, insyaAllah speech akan datang. Okay, so dia nak pergi speech, biasanya kalau doktor refer untuk pergi speech dan speech akan refer pada occupational therapy, kita akan banyak buat aktiviti sensory. Okay, aktiviti sensory untuk stimulate anak tu bercakap juga. Tapi pada masa yang sama, mereka kena buat both lah, terapi biasanya speech dengan OT sekali. Alright. Okay, seterusnya. Okay, biasanya bila anak datang, kita akan buat assessment dan kita akan set the goal. Okay, kita nak goal apa untuk anak tu. Okay, biasanya kita akan normalkan the sensory. Okay, bila anak tu terlampau hypersensitive, you kena normalizekan the sensory. Okay, and then improve the fine motor skill, motor halus dia nak pegang barang, nak menulis, all that. Okay, enhance communication and interaction berkait dengan two-way interaction. Okay, kita akan enhance eye contact. Okay, and then kita akan improve self skill lah supaya anak boleh independent. Alright. Okay, then after the goal, okay, firstly, bila anak datang, kita akan buat terapi yang pertama, biasanya kita akan buat deep pressure brushing technique. Okay, yang ni merupakan satu teknik kita kena guna berus. Okay, berus ni memang untuk anak autism biasanya. Okay, kita panggil therapy pressure brush. Okay, so cara-cara dia memang kita akan stroke dia orang punya tangan, kaki, belakang badan, tapak tangan, tapak kaki. Dia ada protokol sendirilah. Okay, so boleh tengok nanti dan kalau ada anything boleh tanya pihak kami lah. Okay, yang ni satu. Okay, yang kedua, biasa kita akan buat joint compassion. Okay, joint compassion ni adalah untuk improve their proprioception input. Okay, tadi kan anak tak tunjuk mana mata, mana hidung, all that. Okay, so kita akan bagi input joint sense pada sendi-sendi anak supaya diorang aware. Okay, diorang aware, oh tangan aku kat sini, okay, kaki aku kat sini. Okay, so benda-benda tu akan bagi awareness pada anak. Alright, so bila ada awareness, anak akan respond pada environment. Okay, so ini teknik yang kedua. Okay, so basically kita ada juga ball play activity dekat AVISENA. Okay, ball play ni biasanya untuk anak yang sangat geli. Okay, sangat geli, dia tak suka masuk dalam, dia tak suka potong rambut, tak suka potong kuku. Okay, so kita boleh guna salah cara ball play activity lah. Kita akan masukkan anak dalam ni, so kita akan buat activity dalam ni lah. Alright, okay, seterusnya antara teknik yang kita akan guna adalah sensory circuit activity. Okay, goal dia adalah untuk provide sensory input to the child, okay, dan enhance focus and attention skill for tabletop later. Biasanya kalau anak yang kurang fokus, kena banyakkan aktiviti yang gross motor part. Okay, kita kena bagi anak tu lompat, balancing, okay, jalan atas sensory mat untuk bagi dia orang the sensory input. Biasanya dalam 20 minutes or 15 to 30 minutes kita akan buat aktiviti ni semua. Okay, crawling inside tunnel, tummy time, swing, okay. Basically dalam 20 minutes then baru kita akan pergi pada writing, okay, atau tabletop task lah. Okay. Okay, seterusnya dekat AVISENA juga kita ada snoozeling room. Okay, snoozeling room ni biasanya untuk calming down the tantrum child. Okay, so kalau anak yang datang kat kita mengamuk kan, so kita tak boleh nak start the therapy terus. Okay, so kena get to know the child first. Okay, bagi dia orang happy dulu. Okay, so basically kita guna snoozeling room lah. Okay, so kita ada apa yang ni kita panggil to improve eye contact. Okay, kita ada fish inside it. Okay, so bila anak tu sentuh benda tu, dia akan bagi sedikit getaran, vibration dan anak akan start calming down lah. Biasanya dia orang akan okey lah. Okay, and then this one is for the fine motor skill. Okay, dia orang boleh lompat kat atas ni. All the sensory input is here. Okay, so anak akan start calming down lah. Right. Okay, seterusnya. Okay, so untuk anak autism biasanya kalau dengan kami, kita akan ada one session punya terapi lah. Okay, dan kita akan bagi home program apa yang parent perlu buat dengan anak kat rumah. Okay, so senang, yang paling senang kita nak buat home program dengan anak. Okay, storybook activity. Okay, contoh storybook activity kita boleh input dia punya attention. Okay, kita boleh gunakan stiker dan minta anak letak dekat mana yang you nak. Okay, kalau anak tak kenal, you tunjuk benda tu. Okay, contohnya letak dekat brokoli. Okay, letak tangan you dekat brokoli, ambil tangan anak, letak stiker kat situ. Okay, kadang anak autism ni dia respon lambat. Okay, so kita nak dapatkan fokus semua sekali tu, kita perlukan sentuhan. So ambil tangan anak, letak. Okay, instead of you cakap je, dia memang takkan, dia akan buat tak tahu je. Okay, so ni antara aktiviti yang senang jugalah untuk buat kat rumah. And then fine motor ataupun pre-writing activity. Kita boleh guna je sticker dot, okay, boleh buat aktiviti yang simple dengan anak. Okay, follow the line, okay. And then writing, biasanya kalau anak tak suka pegang pensel, boleh start dengan menulis atas pledoh ataupun terapati. Tak semestinya anak tu kena pegang pensel, okay. Sebabnya pledoh ni dia boleh kuatkan tangan lah, dia boleh kuatkan kita punya fine motor skill. Okay, so minta anak tulis atas pledoh dulu sebelum anak tulis atas kertas guna pensel yang betul. Okay, right. Seterusnya aktiviti lain yang parent boleh buat dengan anak autism itu adalah messy play activity. Okay, messy play ni biasanya kita boleh guna pasir. Okay, sebab ada anak yang geli kan, geli nak pegang benda-benda macam ni. So letak je pasir dalam tu and then letak dia orang punya favorite toys and then minta dia orang untuk ambil simpan. Okay, ada banyak cara boleh main dengan anak lah. Kita boleh explore, okay, and then boleh guna sabun, okay, boleh guna sabun letak dalam besin. Just simple activity, tapi macam mana you gunakan play tu untuk ada interaction dengan anak, okay. Alright, so okay, as a summary, okay, parents are the best therapists for their kids. Okay, biasanya bila parent bawa anak jumpa terapis, kami terapis akan ajar cara terbaik untuk play dengan anak. Okay, supaya parent boleh apply dekat rumah. Okay, sebab session dengan terapis cuma 1 jam biasanya. Okay, so parent adalah banyak masa dengan anak kat rumah. So that's why they are the best therapists lah for their kids. Okay, memang kena provide dia the meaningful activities lah for at home. Contoh yang senang I dah bagi tadi, so boleh try. Okay, and then parent yang ada anak autism perlukan knowledge. Okay, perlukan knowledge macam mana nak handling dia orang. Okay, you boleh buat research pasal speech therapy, pasal play therapy, okay, and then need a lot of cooperation between parent and therapist. Okay, tak boleh sebelah pihak je. Okay, sebabnya kita nak improve, kena ada cooperation lah supaya anak cepat improve dan the symptom can be kurangkan lah. Okay, alright, thank you.
Thank you, Ms. Shahida, for the insightful information. Now we should proceed for our Q&A session. So can we get Ms. Farhana to join us back again? Hi, Ms. Farhana.
Hi.
Hi. Okay. So we've got a few questions for yourself and Miss Shahida. So I'll start with you first, Miss Farhana. So some of the questions that we have here is that, what are your thoughts about family play therapy? And do you think it is important for families to participate during therapy sessions?
Okay, thank you so much for the questions. I really think parents' involvement is very, very important in order for the child to get a lot of benefits from the therapy. As what Shaida mentioned in her presentation just now, that the therapy only happens 1 hour per week, or maybe at tops 2 hours. So what happened at home and what do you follow up at home is very much important, and I think that is the most golden time for us, for not us, for parents to be doing the activities or um, the activities that is beneficial for the children. So several benefits would be, you can provide the consistency. So when the therapist gave them okay, what are some activities that you can follow up with your children at home? So I think it will be very good for the parents to try and do it at home to give the child a sense of consistency, familiarity, because especially for children, young children, and with ASD or with developmental difficulties, consistency is some of the keys to help them bring forth their potential and help them to decrease some of the symptoms that they have. And more, we want to also strengthen the child and parent relationship. So if the therapists only provide the activities or provide the therapy session, then at home, if the parents don't continue, then the child might think it's just a weekend thing or just a one-off kind of thing. So you want to also signal to the child that, yeah, the parents is also with you in this journey. It's not just the child's journey alone, it's the family's journey together to to make their his future or her future better. Yeah, that's my point of view.
Okay, thank you. And also, what about children experiencing trauma and loss? Does play therapy help?
Okay, I think play therapy plays a lot with, not plays a lot, we utilizes a lot with emotional difficulties. So children who are experiencing trauma, who's experiencing loss, they have they're going through a very hard time. So for adults like us, if we are going through a family member death, we might talk to our other family members about it, right? We might cry, or we might seek help by, just having someone to listen to what you're currently feeling. But for children, they sometimes they don't know what they are feeling inside. They know that, okay, someone has died, but how are they gonna go through, or how they're gonna face the feelings that they sometimes they don't even know they are feeling lost. Okay, they don't even feel, maybe they feel sad, but how are they going to cope with the sadness? Express. That's with play therapy, actually, we really give them the opportunity to play out their feelings, or maybe we just allow them to express themselves. So I could give an example of a case that I used to handle. This child is going through a divorce. So for them, they lost the mother figure in the family, because after divorce, the child might stay with only one parent, right? So they are left with only one parent figure. So during the play therapy session, the child was showing a lot of interest in playing the dollhouse. So when I was, I allowed the child to just play first by himself, and then I just asked them, okay, are you ready to sleep? Like trying to make some engagement, and then he was responding, oh, not yet. I'm waiting for mom to come back. So when they play out from the session, because I'm not asking directly to him, right? We are asking during a play session. So to them, they are expressing their thoughts and feelings through the characters that they are playing with in the play session. So from there, we can also tell the parents, okay, they are maybe they're missing their mom, or maybe he wanted to see the mom. So from the session, actually, we can get to know what are the children's thoughts.
Yeah, that's true. Thank you, Ms. Farhana. Now, a question for Ms. Shahida. When a child reaches 6 years old and the parents realize that their kid is showing signs of autism, do they make an appointment to see the occupational therapy first, or will they do a developmental screening before seeing the OT?
Okay, right. So for the question, basically when the child is 6 years old, okay, they're ready for the school. Okay, so my suggestion, I think better to meet the specialist first. Okay, meet the doctor first. Okay, doctor will assess the child whether she or he show the sign of autism or not, and then the doctor will refer the case to the occupational therapist, or play therapist. It depends on the situation. Okay, but better seek the treatment from the doctor first. Okay.
Okay, and Ms. Shahida, based on your years of experience working with children with autism, how much of occupational therapy will a child need?
The frequent. Right. So for the session, it depends to the child, the severity of the child, whether it's mild, moderate, or severe. Okay. When the child comes to the therapist, we will assess first. Okay. For the severe case, basically they need everyday therapy. Okay. Some of the cases needs once per week, twice per week, or maybe once per month. It depends to the case, because different autism has different signs and symptoms. They are not the same. Okay. So it depends to the child and also to the severity of the cases lah.
Yeah, and also depending on their progress level as well, right? Like how
Yes.
they progress. Yeah.
Yes.
And also during your therapy sessions with the children, do you also get families involved, or is it a one-to-one that you do?
Right. Okay, so basically I agree with the parents involved. Okay, because during the session, basically therapists will teach how to play appropriately with the child. Okay, so then parent can apply at home. Okay, it's very important for the parent on how to play it properly. Okay, sometimes the kids will play inappropriately, so parents don't know how to respond to it. So it's better for the parents to be involved into the therapy session.
Okay, all right. So that's all the time we have for today's session. Thank you again, Ms. Farhana and Ms. Shahida, for giving us your time this afternoon. It was definitely an informative session. And to all our viewers, thank you so much for joining. Stay safe and stay well. Thank you.
Thank you. Welcome. Macam mana ni? Macam tu je.